Can you count it down? A lovely good morning and a warm welcome to Diamond TV News on the go. My name is Nchimu Nyangando. These are live pictures coming to you from the residence of the UPND leader, Mr. Hakainde Hichilema, who is going to address the nation on something that is very important. That's the issue to do with the COVID-19 pandemic that has so far claimed over 14,000 lives globally, and Italy is one of those most hit nations. Initially, this outbreak did start in Wuhan, that's in China, and as we speak, Zambia has already recorded about 3 cases. The first case was the first 2 cases were recorded over a week ago, which was on Wednesday, and yesterday, on Sunday to be specific, we were availed to the 3rd case that has reached Zambia, and we'll hear from the UPND president what he has to say about the COVID-19 outbreak. So when talking about the number of cases that have been recorded globally, we do have 340,000 cases that have been recorded globally, and from those we have seen 14,704 people dying, and 99,016 of those that belong to the 340,000 that have tested positive have actually recovered. So Zambia has 3 cases, Zimbabwe does have 3 cases, Angola has 2 cases, and the DRC, which is just our neighbor here, they do have 30 cases, and unfortunately one of those that did test positive died. And South Africa has 274 cases. So let's get to hear what the UPND president, Mr. Hakainde Hichilema, has to say about the outbreak of COVID-19, which is now a global pandemic.
Thank you very much. Countrymen and women, coronavirus is real. Coronavirus is deadly. According to the World Health Organization, it has been confirmed that cases of COVID-19 are spreading rapidly across Africa. Therefore, WHO advises African nations to immediately employ proactive mechanisms to combat the spread of COVID-19. In our case here, the Ministry of Health has confirmed 3 cases. 3 cases. So COVID is no longer a tale from a distant place. COVID is amidst us. However, due to limited testing capacity in our country, there could be a number of undetected cases. From experience elsewhere, acceleration of COVID-19 is steep if preventive interventions are delayed. Guidance from the WHO is that African countries should prepare for the worst-case scenario. Once we provide for the worst-case scenario, then we can nip the problem in the bud by assuming an aggressive approach in the process of combating COVID-19. Let's share some basic COVID-19 facts. The reproductive number, an average number, which an infected person will infect others. One infected person will infect others is 2.5. With this calculation, with this formula, from 1 index cases, probable infections after 10 days only, could be 1,600 people. This is a lot of people. We are cognizant of measures announced by the Ministry of Health to prevent or to reduce COVID-19. But these measures from the Ministry of Health fall short of the scale of the problem at hand because of the following issues. Our healthcare delivery system has no capacity to contain the full scale of COVID-19 due to the following: limited diagnostic capabilities, mainly are at UTH only. UTH has only 18 ventilators. The country needs thousands of ventilators, but only 18 ventilators are at UTH. And as you know, COVID patients do need to have ventilation, a lot of ventilation, good ventilation, if I may say so. There's not enough medical staff in our healthcare delivery system. Not enough personnel have protective equipment. That's another challenge. There are also limited treatment options. Due to the above glaring inadequacies in our healthcare system, a number of Western embassies are evacuating what they deem as non-essential staff from Zambia. It tells you that the situation is serious. What needs to be done given these inadequacies in our healthcare delivery system? I mean, what else do we need to do in addition to the measures announced by the Minister of Health? I shall count these by their numbers. Number one, we need a complete lockdown of Zambia for at least 2 weeks to hold new infections. To reduce infections, we need to lock down Zambia. It means we must not allow flights from different countries. Not even those that may not be infected or have not recorded cases of coronavirus. We should just have a lockdown, complete lockdown for 14 days to protect our people. Number two, we should enhance testing for COVID and extend testing services to all the 10 provinces of Zambia. All of the 10 provinces of Zambia. Number three, we ought to mobilize, we must mobilize medical staff, retired medical staff, to be on alert for a possible call to help, and also to enlist help from doctors in the private sector. Very important. Number four, we must procure enough medical equipment and protective clothing for medical personnel on the front line, those that are serving or standing in harm's way, because this disease is deadly. Number five, we must restrict unnecessary movements from our homes, all of us, without exception. Number six, we must encourage all workers, private and public, to work from home. Number seven, we must encourage banks to deal in electronic transactions more than physical cash transactions. Number eight, so to say, we must restrict intercity movement. Domestic travel between cities must be restricted unless it's absolutely necessary. Number nine, we must limit all gatherings to small numbers, extremely small numbers. Probably 50 is too much, maybe far less than 50, even 5, to protect lives. There's no number that is too much if we were to save lives. Number 10, restaurants and cafes, or cafes, as some people may call them, should operate takeaway services only, fast foods only, and not allow people to sit in restaurants for 3-4 hours as they wait to be served, because the potential for infection increases if we conduct ourselves like that. Number 11, remove all import duty and other taxes on medical equipment and personal protective equipment, including masks. All of those equipment, medicines, accessories that are helping in the fight, or we need in the fight against COVID-19, they must be free of duty and any other taxes. Number 12, we must reconvene Parliament to sit, not physically, but virtually, and approve a supplementary budget to fund the COVID activities to buy equipment, to buy facilities, even to pay for adverts in the private media and other platforms so that people can understand what they need to do at a personal level, without exception. This is critical. We must not leave it to the goodwill of the private media to advertise, to promote these life-saving measures. We must pay for it as a country. It's cheaper to pay for it than to lose lives. As simple as that. It doesn't need debate. Number 13, we must withdraw immediately as a country. We must withdraw Bill 10 and channel all the time, all the energy, all the resources into the fight against COVID-19. There's no justification to continue with Bill 10 and to continue spending time and resources when citizens are dying out of COVID-19 infections. And many more will die if we don't take these measures. Number 14, Parliament must exercise strict oversight over all funds, all cash, all resources that are released to fight COVID-19 must not be stolen. Not even a penny, not a ngwe must be stolen from anyone. This corruption habit we've seen by those controlling public resources, please lay your hands off any funds, any resources that are allocated to the fight against COVID-19. We cannot be that cruel to profit from death, to profit from lives of our citizens. That would be irresponsible. So Parliament should exercise oversight on all those resources that are allocated towards the fight against COVID-19. On a personal level, we propose the following measures. Please, number one, please wash your hands frequently with soap or disinfectants. All the time. Number two, no handshakes, no hugs. Fellow citizens, fellow countrymen and women, no handshakes, no hugs. That is not difficult to do, to protect lives of the ones we love. Number three, cover your mouth or nose when you are coughing or when you are sneezing, please. Number four, self-quarantine, meaning quarantine yourselves if you feel that you are not in a good shape health-wise. You suspect that you carry the symptoms of COVID-19, immediately self-quarantine, inform medical authorities. So if it's necessary, you may be moved to a designated quarantine center where you'll be treated. That will help save your life. It will help reduce the infections. Remember the formula of the infection rate, 2.5, using that formula that we've given. It's too many infections could happen out of you alone. Care for yourself, care for others. Number 5, do not panic. Fellow citizens, do not panic. Calm down. Take extra vigilant measures. You must, if you're the leader of a household, a mother, a father, a cousin, and aunt, deliver these messages, basic personal hygiene measures, and how you react to your family members. If the family is safe, the nation will be safe. Prevention of COVID-19 is our collective responsibility, countrymen and women. Please take care of yourselves and your loved ones. Strictly adhere to the hygiene rules or regulations that have been provided for by the Ministry of Health, by the WHO. by messages from others like ourselves through this presentation, through this media exposure that we are giving to the nation. Because this disease is lethal and it spares no one, we must accept that it's here with us. It's no longer stories from a distant country. It is an affliction in our homes, next door, in the next province. In all this, we should not forget to seek the guidance from God our Almighty. With God, everything is possible. Prayers must continue individually in our families. But it's also true that prayer without action may not help the country to protect the lives that are exposed to COVID-19. Remember, we are our brothers, we are our sisters' keeper. Let's look after each other. God bless Zambia. I thank you.